Hello everybody, welcome to today's roundtable. We're going to be doing things a little bit differently today. I will be your host, Derek. I am the director of the Laser Center. And then we have Suzanne, and she is our electrolysis specialist. We have Karen.
Hi.
She is our nurse and also an esthetician and laser specialist. And then we have Marley, who is our PA and specializes in all kinds of things. So today what we want to talk about is all things laser, and that is why we are down in our laser center today. I don't know if you've ever seen any of our other roundtables, but this is our waiting room, so we'll do a little bit of a tour today. And just discuss some of the things that we have to offer, because I think we have so much that sometimes it gets a little confusing. So today we want to focus on just breaking down simply what we can do for you and how we can correct some of those things that might be bothering you over time. So we're going to move on. This is going to be a moving roundtable today. We're going to move on into the treatment room that I use. Right this way. This is our beautiful center that we have. And so here we are in one of the treatment rooms, and this is a lot of our machines that take care of resurfacing and also sweat. So I'll touch on all those things for you. One of the things that a lot of clients come in to ask me about is what can different lasers be used for, and why do they make the choice that they make to be treated with a certain laser. So we have fractionated lasers, we have CO2 lasers, we have radio frequency, microneedling, and all of that can get a little bit confusing for people. So I just want to touch on some of the trigger points that people have. So we have a few different lasers that we work on as far as fractionated and CO2 that are really going to focus on minimizing pores, minimizing fine lines, and overall refinement of the skin. So when we're working with a regular single pulse laser or fractionated laser, you hear the word fractionation a lot. And I get a lot of questions about what does this mean, the difference of a fraxel fractionation. All that it is they have taken lasers now, because in the old days it used to be called a single pulse, and what that would do is just totally ablate the skin. So all of the, and by ablation I mean remove that portion of the skin. So all of the new lasers, what they've done is they've made little tiny beams of light, and there's many little beams of light that come out of one diode. And what they do is create little microchannels in the skin where you're going to develop new collagen, and it's going to create new tissue in those areas. So what that does by fractionating is it allows you to get a pretty serious treatment with very minimal downtime. A lot of the downtime in old lasers could have been up to 2 months to get the resurfacing and the wrinkle reduction and skin tightening that you were looking for. The new lasers and fractionated lasers that we have now, you're looking at anywhere from 2 days, very minimal downtime, to if we do a more serious treatment, it could be up to a week. But you're always going to leave some healthy tissue with these treatments so that there's less risk of damaging the skin. I know some people talk about thinning out their skin. It's not going to do that, because it's actually going to help build strength and build structure in that skin. So those are lasers that are capable of resurfacing. So those are taking care of things like wrinkles, tightening the skin, overall just texturation of the skin and pore size. Then we get into things that are called an IPL. And I know that that's a word that we hear a lot, IPL, BBL. All of these things, it's pulsed light, so intense pulsed light. What intense pulsed light is capable of doing is it goes in and it coagulates anything that's a pigmentation in the skin. So if you have redness and rosacea, if you suffer from little red veins on the face that are called telangiectasia, we can take care of those. If you have brown spots, some people call them liver spots, sunspots, all of that can be removed with an IPL. And that's also a very minimal downtime treatment. Now, what we're also capable of doing now is combining certain treatments. I try to leave that to a consultation with the client because, like I said, we have so much to offer. It can get very confusing as to what machine you're going to pick for what trigger points. So typically you go from the age of the skin and the severity of damage, and then our professionals here are trained very well in the lasers to make a decision for you on what will be best for your skin individually. Now, we do have radio frequency microneedling, which is a little bit different from a standard laser. The way a laser beam works is it's able to go into the skin and hit one portion of the skin that is a trigger point for that laser. When we use a radio frequency microneedle, we are completely focusing on tightening that skin. So we were never really able to tighten the skin as well as we can now with the radio frequency microneedling, because what it can do is it can go in and be retracted at different areas of the skin to build the scaffolding. So in that instance, we're going to tighten jaw lines, we're going to tighten the neck, we can tighten the face, around the eyes, and you see this really deep building of collagen in the skin with one of those. I love to combine that therapy with the resurfacing laser as well, but again, that is something that we'll decide if it's right for you and if it's something that you actually need to have done. So in the realm of anti-aging and resurfacing, we have many different modalities for, again, tightening, coloration, wrinkling. We can treat the eyelids, under eyes, pretty much everything that you would want to look for, including the body. There are specific lasers that are designed. We can treat arms, legs, torso, pretty much treat all of those areas for anti-aging. Our lasers are also capable of treating scarring, acne scarring, post-surgical scarring, which I do a lot of. We can really help reduce scars post-surgery. Up to 6 weeks after a treatment, we can get started on that. So you're going to see a huge reduction in those lines that you have from the scars. And also we can treat striations and stretch marks. We have great results with doing that with these lasers because they're powerful enough to get deep enough into those spots. And then we get into our sweat reduction. This is a machine that is called the Mirror Dry, and this has become a very, very popular treatment. So what this does is it uses heat technology basically to treat the underarm, and it takes one treatment to get an 88% reduction in sweat, odor, and hair. So that's pretty good. The price point is really, really great on this machine, and the results are phenomenal. We do a ton of mirror dries. So we're even able to get into the sweat glands. It's very non-invasive. All of the things that we do down in this center are non-invasive. And then we can also use a radio frequency microneedling device called the Infini to target areas of sweat that are smaller. We can treat an upper lip with this. We can treat different areas of the body that might be sweating on the lower back with multiple treatments of that as well. We also do a machine that I don't have down here because it weighs 500 pounds, is we do tattoo removal, and we do have the true picosecond pico-short tattoo removal machine. We get phenomenal results with this machine. It could also be used for anti-aging as well, but we focus that one on pigmentation, and we can treat all colors. We'll probably move into our other room because that pretty much sums up our resurfacing and anti-aging lasers. Again, we can get a lot more in depth with this, but I like to consult with the client so that we can decide which one of these machines are best for your actual trigger point. If it's sagging, laxity, any of those things, we will design an entire program for you in order to correct those things for you. And then we're going to move on in here. And this is our body portion of the laser clinic. So we have a really nice privatized area where we can do your photos without interruption. We close the curtains. It's just you and I. It's very comfortable, or another one of our technicians. And then we come in here, and we have Marley here today because she actually has some experience as the patient with getting cool sculpting done. So when we talk about cool sculpting, because I know this is a huge buzzword, and a lot of people ask me, what is this machine? How does it work? What does it do, basically? So what cool sculpting does, they're like little metal cups that they have, and there's all different sizes to treat all different areas of the body. What cool sculpting does that separates it from a lot of other fat treatments is causes something that's actually, it's called apoptosis. So it's true permanent fat removal to an area. And it was a technology that was found around the 1970s just by people having a part of their body frozen, and they noticed that it killed the fat cells permanently but had minimal disruption of the outer skin. So when you come in to get a cool sculpting treatment, we measure out the trigger points of the body that are upsetting to you. We can do belly, we can do flanks, we can do inner thighs, outer thighs, underarms, under chin, bra fat in front and back, and pretty much anywhere that we can suction one of those onto you, we'll fit it there. And it usually stays on the skin anywhere from about 35 minutes to an hour, and just is very cold, and it uses that cold to freeze the fat cells permanently. And that's really all that the treatment is. You don't have to go through much discomfort. It's usually around 2 treatments that you have done. It takes 90 days for your body to process that fat for you to see the full results with it. And before we get into the actual cool sculpting, I just wanted to say we also have an M-Sculpt machine, and the M-Sculpt machine is to work on musculature. There is a tiny bit of fat reduction that comes with that, but this can be applied to the abdomen to correct diastasis recti, which is the splitting of the muscle after pregnancy. It's a minimal correction, but for a machine to correct that is really great. You get great results with it. You can do the buttock, so you can give yourself more of a shelf on the buttock and give you larger, stronger muscle in that area. You can treat arms, you can treat calves, and you could also treat the quads. We have different attachments for that to work different parts of the body. So we do package cool sculpting and M-Sculpt together because they're phenomenal together. We get rid of the fat, and then we can tighten and build the musculature around that area. Now Marley had an experience where this is our Cool Mini, which is one of our biggest fat blasters that we have. And this is something that is fitted right underneath the chin to permanently treat that pesky fat pocket that's underneath the chin.
Yeah, so this little fat pocket here, a lot of this is genetics. So even if you're not overweight, if you have that little fat deposition here, that's a lot of it is genetics. So I had 2 treatments of cool sculpting, and I will say, it does take the full 90 days.
Yes.
So I was like,
you have to be patient.
Yeah, you definitely do. And I was like, I don't really know if I really noticed that much of a difference because it's gradual.
Very gradual.
But then we took my before and after pictures, and I will show. So this was, I don't know, is this good? Okay, so the me in the black is before, obviously, if you can't tell, and me in the blue is after. So you can see how much reduction.
And that's one treatment.
So I had a second treatment just maybe like a month ago.
We haven't seen the results.
So
from
right,
that
and
yet.
here's a front view as well. You can see it good. Yeah, and that's just from sitting with a little machine on my little chin fat for 45 minutes, and it's really comfortable.
Yes.
It's a little cold, but other than that, I was answering emails, ordering stuff on Amazon.
Yeah.
It's totally
non-invasive.
Yeah, exactly.
So that's the great thing about our center is that we are able to offer you these options, but we're also a full surgery center. So when people are looking for lasers and looking to improve upon their skin, these are married perfectly together because sometimes it does become a surgical issue. But we have the ability to do these non-invasive, minimal treatments and for a lot less cost, and you get really fantastic results with them, especially cool sculpting.
Yeah.
I've done full body cool sculpting on people that may not have been a candidate for liposuction. Maybe they were fearful of liposuction. But we've had phenomenal results with this. We've also had phenomenal results with the M-Sculpt. Now, our M-Sculpt girl is not here today. That is our Ashley. If she's watching, we miss you very much today. She's our M-Sculpt champ. She swears by it. It's one of her favorite machines of all time. And with that machine, that gets you up to 20,000 muscle contractions in a treatment. So it's like going to the gym and doing 20,000 crunches and laying down. I think it's completely worth it. So then we're gonna move on into our other room and we're gonna discuss a little bit about our hair removal. So our hair removal specialist is in here. This is Suzanne.
Hey there.
And
You're doing a great job.
thank you so much. And just to preface, because I've had a lot of clients that Suzanne's new to us, and I've had a lot of clients that I've already been doing hair removal on. So we have a diode laser hair removal machine, and then we have electrolysis. And Suzanne is going to explain to you why you should do which one and at what point you should do it.
Absolutely.
I'm going to step out and give it to you.
Thanks, Derek. Yeah, so it's a very common question of, hey, I have this extra hair that I don't feel like dealing with anymore. What do I do? Do I do laser? Do I do electrolysis? What's the difference? I just don't know what to do. So basically, they're both wonderful and they both get fantastic results. They both have their pros and cons. So the laser, which we have the Vectis laser right here, laser is wonderful if the hair is dark. So with laser hair removal, you need the contrast between your skin color and your hair color. So if you have lighter skin and darker hair, laser is wonderful. It's also really great for larger parts of the body. So a lot of times neck down, wonderful, wonderful for laser. But you're gonna have people who have either lighter skin, a lot of gray hair, blonde hair, white hair, things like that, which is where electrolysis comes in. So electrolysis you can use on any hair color and any skin color. It's really especially wonderful for the face because we're literally treating each individual hair specifically. So a pro for that is we can do things that the laser cannot. So for example, ears, or we can shape the eyebrow. So can you imagine never having to tweeze or wax your eyebrows ever again? With a couple of treatments of electrolysis, that is actually completely possible. So we can, since we're treating each individual hair, we can really go into in the face and do a lot of really wonderful things. So basically, if your hair is dark and on the body, laser absolutely your best option. If face and if your hair is lighter and or darker, it doesn't matter, but usually for the face it is electrolysis. Both are a process and it's usually every about 3 or 4 weeks. Both of them require multiple sessions to get all the results. Both can be a little bit zesty, not gonna lie, but totally tolerable and the results are absolutely worth it. So if you're interested in either the laser or electrolysis, we also can have a consultation to see what's the best option for you. Okay?
Thanks, Suzanne.
Thanks, Suzanne. So we'll come back in here and finish it up, and this is where you would get to hang out and relax before you get your service. So not only are you getting medical treatments, but you get a little bit of the spa quality while you're in here as well. And I know we're talking about lasers today, but a really great thing that we have to offer post-laser is a lot of treatment and our own medical skincare line that's going to help you maintain the results of your lasers and to keep your skin looking really fresh. We will suggest a maintenance package for you once you do a treatment to keep everything going and keep your collagen building. And another point I just wanted to touch on quickly that I didn't in the treatment room is the fact that we are able to really manage pain in this facility because we are a medical center. So we have our own privately compounded topical lidocaine treatment that is a high lidocaine. I mean, you feel nothing when you have that on your face. So you come in and we do about an hour of that. And when you have your laser resurfacing, it's extremely comfortable. We can also use it for electrolysis or hair removal if it's something that you can't handle. And then to take it a step further than that, because we have the medical team, we also use something that is called the Pronox. So that is a self-administered laughing gas split, and it just takes the edge off. It kind of helps you get through a treatment if you do decide that a heavier CO2 treatment is needed for your skin. We can make it very comfortable because that's part of it. Gets a little hard to get through with some of those treatments. With that being said, that is it for the Laser Center. If you have any questions for us, if you want to set up a consultation, all of our consultations are free. We love what we do here, so we would love to meet with you and talk about what some of the things are that you'd like to correct for the new year. This is also the time to start with laser resurfacing. So fall, this time of year when the sun is less strength, this is when you want to do it. I know we get a lot of phone calls in the summertime to start with resurfacing. You're exposed to a little bit too much sun, so it's not the best time for hair removal or for laser resurfacing. So now is the time. We will be running some specials soon, and we will keep you guys posted on any new information that we get.
Talk to you soon. Thanks, everyone.